Hi there and good afternoon. My name is Lori Shipley and I work for Renew Hope Counseling in Dexter, Michigan. I'd like just to take a minute today and talk about something that's not really talked about a lot in our relationships, but basically our thought life. It's pretty important and it affects our day-to-day living in more ways than most human beings are conscious of. So, in psychology, some of you may have heard of something called cognitive behavioral therapy, or CBT. It is basically a treatment that has been shown to reduce depression, anxiety, and as a therapist, I use this all the time. Now, when I ask most people what cognitive behavioral therapy is, or CBT, most people say, I don't know, I've never heard of that. And so really, long story short, cognitive behavioral therapy is simply examining or looking at some thoughts that we have playing in our mind, like a record player or like a rumination. And they're generally based on beliefs or a belief system that we have picked up maybe along the years, either in childhood or in a bad relationship. Generally, they can be very negative and they may be provoking anxiety and depression. So in my work with clients, I like to first of all find out what are the thoughts that are rolling around in their head on a day-to-day basis. Oftentimes people say, I really don't know, I never really thought about that. But generally, if we take some time and look at some core beliefs that people actually feel about themselves, we can identify some issues, and usually we can go back to figuring out where those beliefs have actually come from. That usually brings some relief to both anxiety and depression, and then work can begin. This is not just a psychological issue, but actually the Bible talks about this. In the New Testament, the Apostle Paul talks about taking every thought captive and making it obedient to Christ. I think he was onto something there. So again, if you're struggling with anxiety and depression, feel free to make an appointment. We can talk about some of the thoughts that you're having, some of the issues that are coming from these thoughts, and just generally being more aware of really what's going on can be really, really helpful. Thanks. That's all for today. Have a great day. Take care. Bye-bye.